Thanks for inviting us in. We want to begin tonight at 5 with this big step in treating COVID-19.
That's right, and it comes from the FDA just granting emergency use to Pfizer for the first pill that you can take at home as a treatment. It's called Paxlovid, and doctors can prescribe it to anyone who is age 12 and up.
However, the priority is going to go to those people who are considered high risk. So we're talking about people most likely to get severely ill from COVID. That's because the initial supply will be extremely limited with enough doses to treat about 10,000 people.
The White House has ordered 10 million treatments so far.
We will have 265,000 treatment courses of Pfizer available in January, with monthly totals of pills ramping up across the year, and all 10 million treatment courses delivered by late summer.
Be taken within 5 days of symptoms to be affected. You'll then have to take 3 pills twice a day and do that for 5 straight days.
Now, Pfizer has said this pill should work against the Omicron variant, which is now in all 50 states. The FDA is also reviewing another pill treatment tonight. This one is from Merck. The agency's advisory group voted narrowly in favor of recommending that drug last month.
As for the popular antibody treatments, the Omicron variant now is challenging their effectiveness.
Yeah, doctors have used drugs from Regeneron and Eli Lilly to fight COVID for more than a year.
But as our Lauren Kosick reports tonight, hospitals might have to rethink their current treatment plans.
Doctors and hospitals are facing another threat from the Omicron variant. Research shows some of the monoclonal antibody treatments used to keep COVID patients from developing severe symptoms are less effective, including a popular treatment from Eli Lilly. Hospitals across Indiana are already stretched thin, short-staffed, and tired from the Delta surge, and are now facing another battle. On Monday, the Omicron variant officially became the dominant strain in the U.S., making up about 73% of new cases, according to the CDC.
And we need to tailor our treatment algorithms appropriately. So knowing which variant is present may impact treatment.
That's because some of the COVID treatments used to keep high-risk patients from getting seriously ill are shown to be less effective against the new strain. And the one that does work is in short supply.
Now, this is very early in the studies, and there's more research going in, but the early data suggests they're not as effective as they were maybe against Delta or other variants of this virus.
Thomas Dazinski said this isn't surprising because the variant is different than the virus that antibodies were trained to fight.
You know, we don't want to change vaccines. We don't want to change these monoclonal antibodies if we don't have to. So if there's some level of efficacy that is still there, then there's really not a need to change.
And this could also put another burden on hospitals, having one less tool in the toolbox. That's why Zazinski says it's important for Hoosiers to avoid infection by staying protected.
Because every time somebody gets infected, we have this opportunity for a new variant or mutation to occur in the population.
Eli Lilly said they are developing another treatment that would work against all strains of the virus, including Omicron. But right now it's not approved. They hope to give another update in a few weeks.
Thank you, Lauren. The White House COVID response team addressed this news today as well. They acknowledged 2 of the 3 treatments given in hospitals aren't effective against Omicron. So they've offered more of the GlaxoSmithKline treatment since it does apparently work against Omicron.
Well, we got some encouraging news coming out of South Africa today. The New York Times is now reporting cases of the Omicron variant are slowing down, suggesting it's already peaked there.
Researchers in the country told the Times cases have dropped by more than 20% in the last week. Omicron does appear to be milder, at least for those who are up to date on their vaccinations. But you still need to keep in mind the symptoms and take it seriously if you are experiencing any of these.
The top 5 symptoms are on your screen right now. So we're talking about runny nose, headache, fatigue, sneezing, and a sore throat.
Even though Omicron cases are rising, people are still getting infected right now with the Delta variant.
So today we've been talking about this issue, and we want to know, can you be infected with both? Our Matt Gregory verifies for us.
Our research and experts say yes, you can be infected with both. But before you get alarmed, they also say that doesn't necessarily mean it'll be a more severe infection. We verified. Can you get infected with both the Delta and Omicron coronavirus variants at the same time? Well, to find out, we went to Dr. Sarah Lynn Mark, a former senior medical advisor at the White House. the CDC, and 2 peer-reviewed studies on co-infection. So the answer is yes, according to a study published in January of 2021 from Fevale University in Brazil. Back then, researchers found evidence of co-infections of multiple virus strains in patients. And this checked out with another study from 2020, where French researchers at the Pierre-Louis Institute of Epidemiology and Public Health found the same thing: 2 strains of COVID-19 in one body. Our expert, Dr. Sarah Lynn Marks, said even though it is possible not to be alarmed, a co-infection doesn't necessarily mean it'll be more severe. It's just something that researchers need to monitor. So yes, it is possible to get co-infected with both the Delta and Omicron variants. Dr. Marks says the more concerning multi-infection would be one or more of the variants combined with the flu. With Verify, I'm Matt Gregory.
Well, we have been seeing a lot of this, long lines across the country, all these people waiting to get vaccinated or tested for COVID.
Today we took these images from Drone Cam 13, offering you this, a bird's eye view of the line. This is the IndyCar parking lot right across from IMS. It's open until 8 o'clock tonight, and then it's going to close until after the Christmas holiday.
Now, our country's top doctors have been urging people to get tested ahead of family gatherings this weekend. You got to look at this line in Florida. Look at all of this. This is a drive-through testing site in Florida. It's open 24/7. This is in the Miami area.
They provide the antibody treatment for people who are infected there. And they've had so many people show up there that they've even run out of the treatment.
Yeah, amazing long lines there. This is why it is so important for all of us to get vaccinated and get boosted as well.
Today, the director of the CDC said those who aren't vaccinated are more likely to get COVID-19.
CDC data now updated through November, when Delta was the predominant strain circulating, demonstrated that an unvaccinated person has a 10 times greater risk of testing positive for COVID-19 and a 20 times greater risk of dying from COVID-19 when compared to those who are fully vaccinated and received their booster dose.
An IU Health doctor has been voicing his concerns about the vaccination rate here in Indiana. And he's been doing so in front of not only Indiana state lawmakers, but even expressing his concerns on national TV.
Yeah, today he used a couple of charts and a tweet to try and get his message across. So we want you to take a look tonight. You see this blue line here? That's Indiana. The red line here shows Massachusetts.
Dr. Gabriel Boslet goes on to say 2 states, 2 pictures, almost identical population sizes. Massachusetts has 73% vaccinated, Indiana 53%. Cases are nearly identical, but deaths are twice as high in Indiana. Get vaccinated. End quote. Well, Indiana hospitals have been swamped with COVID patients. The White House has even sent in some military help, some medical help to help IU Health.
But it is not just hospitals here in Indianapolis needing more of these resources. Our Jenny Runovich reports tonight surrounding counties are struggling as well.
Hancock Regional Hospital in Greenfield is maxed out. Every single bed for seriously sick Hoosiers is full. Half right now are COVID patients, and almost all of those are unvaccinated. It's a major struggle for smaller hospitals, especially with staffing levels affected by retirements and burnout during the first COVID wave last year. The healthcare heroes who remain are exhausted, and doctors say this current surge of patients isn't even at its peak. Already, it's led to longer wait times for treatments, postponed elective surgeries, and figuring out creative ways to care for people.
We've been at capacity here for the last probably close to 3 weeks. We're constantly holding patients in the emergency department waiting for discharges to come in.
We will have beds in places we never dreamed. We will redeploy staff in ways that we never imagined we would, and we will take care of people. But it ought not be that way. This is a situation that can be prevented.
Hospital leaders still stressing that vaccinations and boosters are the way to ease the strain.
Thank you, Jenny. And you know, Hancock County, not the only smaller community here in central Indiana coping with the surge in patients at the hospital right now. For example, the ICU, the intensive care unit that's at Columbus Regional in Bartholomew County now, is telling us they're on a case-by-case basis because it is nearing capacity there.
Well, college football's postseason is getting hit by this pandemic surge.
Today, Texas A&M pulled out of the Gator Bowl because of a COVID outbreak on their team. And now the College Football Playoff Committee is issuing new rules leading up to the national championship game. We're supposed to be hosting that here in Indianapolis. And this basically allows for a team to advance to the championship game and ultimately win it if the other teams have to forfeit.
So this championship game over at Lucas Oil Stadium is set for Monday, January 10th, but that game could be pushed back to Friday, January 14th. Worst case scenario here, the championship would be canceled if both teams cannot play. And the NFL knows a little bit something about rescheduling games. It had to move 3 games of this week because of COVID outbreaks.
That's right. What it hasn't done is cancel the games, just postpone them. But the league has thought about it. Washington, Cleveland, and the Rams risk losing their game under some of the new rules that were passed last season.
The NFL, though, says cancellations is never the #1 plan, but instead they want to figure out a way to play the games safely and responsibly. President Joe Biden is extending that moratorium on student loan payments until May 1st. Interest rates will stay at 0% during that time as well. Those measures were put in place early in the pandemic and were then set to expire January 31st. This is now the second time the president has extended the moratorium, saying he understands borrowers are still coping with the impact of this pandemic.